Good afternoon, everyone. This is Shannon Snedaker of Snedaker Law here for another Snedaker Spotlight. And today we have Dr. Steflik here from Coastal Integrative Healthcare. Good afternoon. How are you doing?
Doing great. How are you doing?
I'm doing great. Thanks for being here.
Yeah, my pleasure. Happy to be here myself. I'm here every day.
Well, that's good. And yes, we are in your practice today. And where exactly is your practice located?
So we are in the big city of Edgewater, which is right next to New Smyrna Beach in Volusia County. We also have an office location in Palm Coast up in Flagler County. And we have in the works plans for an office in West Volusia County. Hopefully by January 1st, we're working on contracts and deals right now. So hopefully we have something set up in the next few months. We'll let everybody know when we do.
Yeah, that's great. So tell us about Coastal Integrative. What type of practice it is? I know you have multiple offices, mostly in Volusia County, but tell us about your practice and what you do.
So I'm a chiropractor, and I'm the owner of the clinics, but we have other chiropractors. We have medical staff, so nurse practitioners. We have a medical doctor that oversees everything, and we treat any type of pain. We want to take care of anyone that's in any type of pain, whether it's arthritis or from an accident or injury. Those are two of the areas that we focus on the most. But we use a holistic approach, so we don't do any prescription medications. We don't do any drugs. Everything we do is no surgeries. It's holistic. It's natural. The philosophy is the same that you'll see in a lot of chiropractic offices, that we want to correct the cause and not just cover up the symptoms.
Right. Well, and you mentioned holistic, and you and I had the opportunity to talk before we started today. But what is holistic, healthcare, or the medicinal approach using, holistics? Tell us about that, and what could a patient expect if they wanted that type of treatment?
Yeah, so we see this all the time. Patients that will go to another clinic and they're looking for pain relief. Well, you can get pain relief through a lot of different ways. It could be anti-inflammatory medications, it could be steroids, could be opioids, and that's not going to actually fix the problem. And most people know that. They don't really want to just cover up the pain. They want to actually fix the problem. Most people intuitively know that if something is wrong, they need to fix the problem in order for it to go away permanently. So, that's the allopathic mindset is a prescription or something to just make them feel better. Whereas, our philosophy is, like I said, fix that cause of the problem, kind of dive in deeper, properly diagnose it, and then give the right treatments.
And what are the treatment options? I mean, I know that just getting a prescription can kind of act like a Band-Aid, or it masks the pain, but it doesn't treat the pain. So what are some of the treatment options that patients would have in your office to actually dive deeper and treat it and not just put a Band-Aid on it?
Yeah, so we have a lot of different injections that we do, holistic injections. So we don't use, like I said, we don't use cortisone. We'll use something called Trameal, and that's a plant-based injection. So we can get into the knees, any joint, we can do to the muscles. So sore, achy muscles, like after a whiplash or a car accident, that'll feel really good. So the injections are so holistic that the bottles, they have no side effects. You could literally drink a bottle of the product and it wouldn't harm you. So very, very safe, first and foremost, with some of the treatments that we do medically.
Just out of curiosity, why do you not use cortisone injections? So what is it about cortisone? Because I'm sure a lot of people out there who've had problems. I know my husband's had problems with the shoulder, and I think he's received a cortisone injection that seems like a go-to from an orthopedic standpoint. So what is it?
Yeah.
Why do you shy away from them?
If you look at some of the recent research, if you just go to Google, type in cortisone side effects, and you'll see what shows up. And recently, there's been a lot of research showing that a cortisone injection, it's going to provide some short-term relief because it's going to knock down the inflammation, but long-term, it actually wears out the joint faster. So someone that's had an injury or someone that's has arthritis, they're going to potentially wear that joint out faster and get closer to a replacement or a surgery than if they were to get a holistic treatment. So we educate our patients and let them know, hey, here's the downside of getting a cortisone injection.
Right, well, and you don't want to speed up that potential need for surgery. You want to slow it down.
Yeah.
Right?
Exactly.
Patients typically don't want to go have surgery.
Not usually.
So if there's an option to slow down that inflammatory process, that's more holistic, that would be a really good option for a patient.
Yep,
Right.
that's what most people want. So they just aren't presented with those options, and we want to at least educate and present those options for them. So, yeah.
That's great. So I know we had an opportunity to talk earlier too about how your clinic focuses a lot on brain injuries, specifically from car accidents, but also all types of causes of brain injury from something traumatic, right?
Yep.
So tell us about that. So what do you do for your patients here to help them if they've suffered a brain injury or even diagnosed that they've suffered that?
Yeah, so I shared like an example earlier today. We had a patient that came in that was in a car accident, and she'd been treating with other doctors for the car accident for the last 18 months or 2 years, and she still has headaches. A lot of people don't know that, the headaches, there's a lot of different causes of headaches. It could be just you're dehydrated. People think that all the time living in Florida, they're not drinking enough water. But if you've been in an accident, sometimes that headache may not show up for another few days. And mild traumatic brain injury or just a brain injury is one of the most severe injuries you could have from an accident. Think about what controls the rest of your body. It's your brain. And so it's highly important that it actually gets diagnosed, and it's one of the most commonly misdiagnosed misdiagnoses out there, that they never get diagnosed. If they don't get diagnosed, you're not going to get the right treatment. And the treatment is, we have a list of 10 different types of treatments you need if you have a traumatic brain injury. But first we've got to diagnose it with a neurologist, and it's got to be a neurologist that specializes in brain injuries. If they're not specializing in brain injuries, they might just miss it completely. If you get a brain MRI is probably not going to show your brain injury unless it's like you're about to stroke out, which is rare. In that case, it's severe, not mild. The mild ones will get missed on an MRI. There's other testing that needs to be done, and that can be done to diagnose that brain injury, and then we can start in some of the treatment options.
And before you get into the diagnosis, if a patient or potential patient is watching this today or listening to us, and we're in a car accident and they're struggling and they're in pain, what are some of the symptoms that you've seen patients have that it's really a traumatic brain injury that they've experienced and not a shoulder injury or a neck injury? It's actually stemming from the brain. What are some of the symptoms that they should be looking for? So
we have a checklist because there's so many things that you wouldn't think would come from the brain injury. In your head, another thing going back even before we diagnose it is your head doesn't necessarily have to hit anything in the car for it to be a brain injury. It could be just the movement of your head moving back and forth, and since your brain is essentially floating in the fluid, it could hit the front and the back of your skull, and that could be enough to cause the brain injury, or a shearing motion, twisting motion that can pull even on the brainstem. So some of the symptoms we see, headaches are common. Any visual changes, so blurry vision, double vision, tinnitus or ringing in the ears, balance issues, vertigo, nausea, digestional, stomach problems. There's a whole plethora of a checklist that we want to go through to check for these brain injuries that people have.
Okay, so if a patient comes in and they're having some of these symptoms, you'll send them out for the correct MRI to make sure that they have the correct imaging done so they can have that diagnosed, and you work with a neurologist. But then what do you do from a treatment perspective for those patients who may have been experiencing symptoms and then are diagnosed with a traumatic brain injury?
Yeah, so once we get that diagnosis, there's about 3 different tests that we want to do, and they're done at a special imaging center, and it's like diagnosing, it's comparing seeing damage to blood vessels that are as small as a few strands of hair. So it could be a really small micro hemorrhaging that could cause the brain injuries. But once we get that diagnosis and once we know that's what's going on with the patient, some of the treatments that we do, one is called alpha stim, and it's a electrical current that connects to the ears of the patient, and it stimulates alpha waves in the brain, which is great for people with anxiety, depression, or have any PTSD type traumas. We also do vagus nerve stimulation. We're connecting, it's like a TENS unit to the wrist and then also to the tragus, which is this part of the ear, and that little part that sticks out. If you research that, you'll see that people that have migraine headaches will often get that part of the ear pierced because it can provide lasting relief from migraine headaches. But we can stimulate that. That's your vagus response that can cause some of those headaches from a brain injury. We'll do LED light, therapy to the brain as well, which will stimulate blood flow. We'll do oxygen with exercise. So we'll get the heart rate up, get some oxygen, that will help. We'll do brain games, just stimulating memory and brain games on a tablet while they're doing some of these other therapies. We do ocular motor tracking. So if their eyes, a lot of times the muscles in the eyes are not coordinating, that's what's causing the headaches because of the injury to the brain. So we need to retrain the eyes to be able to move in coordination with each other. And there's different ways we can do that as well too. So there's a list of other things that we do for brain injuries, but most offices are not equipped to handle all of that.
Yeah, that was one of the things I wanted to bring up next, was that you are one of the only offices that focus on brain injuries, or if that's a part of your practice in addition to the other treatments that you offer.
Yeah,
right?
Yeah, definitely. Yeah, there's a few other offices. We have an office up in Palm Coast, up in Flagler County. There's another office in Daytona Beach. There's us. And that's about it really for the area. So people, if they're going to get that specialized type of treatment, you need to go to an office that actually treats that.
Well, and I know in my experience in representing personal injury clients, there's a lot of people who have continued pain, even though they've had chiropractic care, they've had physical therapy, they may have had epidural injections, and they're still having issues and they feel hopeless. And so a lot of times it's actually something else going on that was overlooked because the training wasn't there.
Yep, it's so common. That's one of the, like I said from the beginning, one of the most commonly misdiagnosed or just missed diagnoses out there that patients have, and they, it's frustrating for the patient because they don't know what's wrong with them, and so they don't know what to do, and they don't know what doctor to see. They don't know who they should go see. And as a patient, it's your right to be able to see which doctor you want to go see, that you want. So if you're not happy or satisfied with your doctor, you're not getting the right answers, you should be looking for an office that specializes in that and can actually treat it for you.
Right. Well, in addition to the brain injury treatment and the holistic, you also treat car accident patients as well, right?
Yeah.
Yeah.
I'm not gonna say good old whiplash, but yeah, there's
number one injury for car accidents, right? And I know some viewers, I know a lot of my clients don't know this, so I'm assuming a lot of viewers out there may not realize this, that after you get in a car accident and you call your primary care doctor, they might not be able, or more likely than not, they will not be able to see you because they don't take car insurance. But that's something that you take here, right?
Yeah, we work with a lot of the primary care doctors in the area too that send us, their patients because they won't see them if they've been in a car accident. And we want to keep the primary care updated because they still want to help the patient, but they just don't take the insurance. They don't, they're not equipped to do that, those types of treatments.
And you're not taking over complete care of that patient. You're just taking care of them after the car accident.
Yeah, we're just coordinating care, and we want to make sure that, same thing, that they get a proper diagnosis and proper care, because the sooner, all the research and studies show, the sooner somebody gets in, gets care, and starts feeling better, the better the long-term prognosis, the better the long-term outcome is for that patient. So if that's put off and delayed for even a few days or a few weeks, then it really hurts the potential to heal properly.
Right. And tell us about your X-ray machine that you have here. It sounds, I'm not even going to try to explain it because I will mess it up. So I'm going to let you, the expert, explain that cool diagnostic machine that you have in your office.
Yeah, so a regular X-ray machine is going to take a picture, like a still frame. So it's like taking a camera, you'll take a picture, you get an image of what's happening. The X-ray machine we have, it's a digital motion X-ray. So essentially it's taking a video clip. So instead of getting one picture, you're going to get thousands of pictures that show the full motion of a person's head. And this can actually oftentimes find injuries that don't show up on an MRI. So maybe they have a disc bulge or something minor on an MRI. A disc bulge wouldn't be considered something major most of the time, but they have a lot of neck pain and they don't know why. So we have a lot of people that come to us just for the X-ray, the digital motion X-ray and the report. that will show exactly where their injury is, and then we can give them or recommend proper treatment. And we've had people fly in from out of state to get the x-ray done. So I've had somebody from Colorado, people from Tampa, all over the state of Florida, just to get that x-ray and the report to know what's actually going on with them.
And is that because this type of machine is not common in the practice, or why are people flying in?
Yeah,
Tell me about that.
It's hard to find. There's only a few, like I said, I think we're the only ones in Volusia County. I know there's another one like in Ocala, there's one in Tampa. They're not all over the place. It's not a common machine. A lot of it's probably due to the cost of the machine and what it takes to understand how to use it. But yeah, so it's I think we're the only ones in Volusia County. I haven't seen anyone else out there that has one in the county.
Nice.
Yeah.
Well, where can these patients that might be, or future patients who might be watching today, where can they find you? So do you have Facebook? Do you have social media? Hopefully someone's doing their job out there, right? Exactly. Yeah, so where can people find you?
Yeah, so I mean, obviously you have phone numbers, websites, but we have YouTube channels as well too, but our website, Coastal Integrative Healthcare.com. We've got, just if you Google us, hopefully we show up right away. That's what most people do now anyway. Like giving a phone number is almost worthless because you can like write down a phone number. But website, if you just Google us, Google my name, Tim Steflik, and you'll find lots of ways to contact us. It should be easy. Click here, schedule now, all that stuff.
And I should be following you. I think I am following you. If I'm not, I'm going to. So you can follow us as well, Snedaker Law, and you will find Coastal Integrative from our Facebook page and Instagram as well.
Awesome.
So anything else you want to share with us today before we sign off on this Snedaker Spotlight?
I think we covered some pretty good stuff. So yeah, happy that it's our passion. That's what we love doing, is helping people that, it's like, I get excited about it. I love helping people that have maybe had problems or difficulties somewhere else. They're not finding answers. They're not getting the help that they need. And they come to us and it's a breath of fresh air. We're able to give them some hope again. And, when someone's losing hope or they're frustrated or irritated, we know people coming in are going to be a little bit grumpy sometimes because they feel bad and they're losing hope. And we just love giving that back to them and getting them back on their feet and helping them feel better. So whatever it is, that's what we want to help them with.
And doing it in a natural way.
Yeah, exactly.
Not just putting a Band-Aid on it. So.
No Band-Aids.
Yes. Well, thank you so much for being here. Thank you all for tuning in. Shannon Snedaker of Snedaker Law here for another Snedaker Spotlight.